Hey everyone, and welcome. Today, we are going to pull back the curtain on something we've all experienced, the good old eye exam. We're going to break down every single step, from those first few questions all the way to that moment the doctor looks right inside your eye. So, let's dive in. You know that feeling? You're sitting in the chair, staring at those letters on the wall, and you can't help but wonder, what does this all actually mean? What is the doctor really searching for in there? Well, stick around, because we're about to find out. You might be surprised to learn that the exam doesn't kick off with any bright lights or fancy gadgets. Nope, it starts with something much simpler. Just a conversation. Your own experiences and any symptoms you've noticed are the very first clues. So your doctor's going to ask you about your history. Things like, have you been seeing any weird floaters, experiencing any eye pain, had any injuries? This isn't just small talk, not at all. Your answers are actually a roadmap for the entire physical exam, helping them know exactly what to zero in on. Okay, let's get to the part everyone knows, the most iconic piece of the whole exam, the eye chart. We've all squinted at it, but what do those numbers they shout out, like 20/20 or 20/40, really represent? Let's finally decode this thing. So, let's just imagine for a second that you're going through the test and the doctor says, okay, your vision is 20/70. We've all heard phrases like that, but honestly, it can be kind of confusing. Right? What are these two numbers really telling you about how well you can see the world? It's actually way simpler than you'd think. The top number, the 20, is your distance from the chart. That's almost always 20 feet. The bottom number is the key. That's the distance where a person with perfect vision could read that exact same line. So if you have 20/70 vision, it means you have to be standing at 20 feet to see what someone with normal vision can see from 70 feet away. Simple as that. Now, this whole chart test is mainly checking for two super common conditions. If you have a tough time reading that distant Snellen chart, that's nearsightedness, or what doctors call myopia. But if you're the one who has trouble reading a newspaper or a menu up close, that's farsightedness, also known as hyperopia or presbyopia. But seeing what's straight ahead is only one piece of the puzzle. A thorough eye exam also has to check your peripheral vision, what you can see out of the corner of your eye. One of the quickest and easiest ways to test this is the finger wiggle test. It's pretty low tech. While you cover one eye, the doctor will bring their wiggling fingers in from the sides. It seems basic, but this simple action helps map out your entire field of view to make sure there are no hidden blind spots. And next up, the doctor needs to find out if your eyes are good teammates. Are they working together? Moving in perfect sync? Are they properly aligned? Let's see how they check. To figure this out, they'll run a few quick drills. First, you'll follow their finger as it traces a big H in the air. This checks all 6 of the tiny muscles that control your eye movement. Then, you'll follow that same finger as it moves right towards your nose to test convergence. And finally, they'll grab a light for one last alignment check. This last one is called the corneal light reflex. The doctor shines a light at your eyes, and all they're looking for is that little glint of light, that reflection. They want to see if it appears in the exact same spot on both of your pupils. If it does, that's a fantastic sign that your eyes are perfectly aligned. All right, now the doctor gets to take an even closer look. They're going to inspect all the external parts of your eye. And when I say everything, I mean everything. They're looking at your eyelids and eyelashes, the white part of your eye, the sclera, to check for any redness or yellowing. They'll check the clarity of your cornea and your lens, and even take a look at the size and shape of your pupils. Now, during that pupil check, you might hear the doctor mutter this acronym, or maybe you'll see it written down in your chart later, PERRLA. PUPRL is just some handy medical shorthand. It stands for pupils equal, round, reactive to light, and accommodation. It's basically a super quick way for the doctor to note that your pupils are healthy and responding exactly how they're supposed to. A perfect score. And now, for the grand finale. This is the part of the exam where the doctor uses that special instrument to look directly through your pupil and into the very back of your eye. Using that tool, the ophthalmoscope, might look really complicated, but the process is actually pretty methodical. First, they darken the room. Then the doctor stands off to the side, shining the light to find a specific orange glow called the red reflex. Once they've got that glow in focus, they move in closer and closer until the amazing internal structures of your eye just pop into view. And what they can see is, well, it's incredible. They can see the optic disc where your optic nerve plugs into your eye. They can see the tiny arteries and veins of your retina, and even the macula, the part that gives you your sharpest, most detailed vision. It's a direct, live look at your nerves and blood vessels. No surgery required. Pretty cool, right? So, after all of those tests, the questions, the charts, the wiggling fingers, the bright lights, and that super close-up view, what does a completely healthy, all-clear report actually look like? A perfect report card would say something like this. And if you look closely, you can see all the terms we've been talking about, from Vision 2020 to that PERRLA acronym. Plus, you see notes about a healthy optic disc with sharp margins. This clinical language is really just the doctor's way of saying everything looks absolutely perfect. And that pretty much wraps it up. But it's just fascinating to remember that the eye is literally the only place in our entire body where a doctor can look directly at our nerves and our blood vessels without making a single cut. It really makes you wonder, as our technology gets better and better, what other secrets about our total health will this tiny little window reveal next? Thanks for joining me.